You're watching Breakfast Central on News Central. Standing by to give us the latest COVID-19 update is Michael Ngene. Good morning, Michael. So good to have you once again.
Good morning, Oluchi. Good morning, Joy. It's important to let you guys know that I bring good news today because the war against COVID-19 pandemic is I can authoritatively tell you that Africa, we are gradually winning this war. And talking about winning the war and also sticking with issues regarding the easing of lockdowns, President Nana Akufo-Addo of Ghana has announced an end to all COVID-19 restrictions and ordered the reopening of the country's land and sea borders. The president, in a televised broadcast, assured Ghanaians of better economic times ahead. In his words, this is what he said: "It has been a difficult 2 years for all of us, and we are seeing light at the end of a very long tunnel. I assure you that sooner rather than later, our economy will rebound from the ravages of the COVID-19. And of course, it's also important, let me tell you, that Ghana moves to reopening its land borders and sea borders will mark an end to months-long COVID-19 restrictions in the country. But Ghana is not the first country to actually do this. For instance, Uganda fully reopened its economy back in January after struggling with COVID-19-induced economic recessions. And of course, other African countries like Kenya and of course, Zambia right there. It's also, taking you now to Botswana. Another good news, actually, if you ask me, because the country has become the first country in Africa to approve the use of the Texas-made COVID-19 vaccine, Corbevax. Botswana's president and California biotech company NantWorks made the announcement this week as they began construction of a plant to produce COVID-19 vaccines and drugs to fight cancer as well. CEO of biotech firm NantWorks, Patrick Soon-Shiong, during a groundbreaking ceremony for a vaccine and cancer drug production facility, announced that Botswana's Medicines Regulatory Authority, that is the BOMRA, had approved the Corbevax jab to be used right there in Botswana. Now, Corbevax is a patent-free COVID-19 vaccine developed by the Baylor College of Medicine and Texas Children's Hospital in the United States, and has been used in Bangladesh, India, and Indonesia. Now, the plant, which is expected to start operation by the year 2026, plans to produce vaccines for COVID-19 and other diseases, as well as cancer treatment drugs. Before now, if you remember, Joe and Oluchi, I brought you a report about this same company opening up a COVID-19 plant in South Africa with plans to have that plant produce over 1 billion COVID-19 vaccines. And there also talks that that plant in South Africa will start working or start producing vaccines from November of this year. Isn't this a great way to actually start wrapping up, as we keep on getting away from this pandemic that has been with us for close to 3 years now? But also, let me let you know real quick that the numbers are still rising in some places. But let's start with Africa, looking at the figures from the Africa CDC in terms of how many cases have been recorded. We have over 11,323,949 confirmed cases of COVID-19 in Africa, with the death standing at 250,948, and number of recoveries stands at 10,635,124. Let me also take you globally now and let you know what the numbers are looking at globally in terms of the COVID-19 pandemic. Confirmed cases globally stands at 481,700, or rather 481 million, I beg your pardon, 756,671, and the number of deaths stands at 6,127,981. Virus and this pandemic will be leaving anytime soon, but let's not relax. Let's not feel, oh, we've won the war. Yeah, we are winning the war, but we still have a lot more to do to ensure that we eradicate this virus that has been here, messing up economies, bringing countries down to its knees. In fact, I think this generation will keep on referring to this pandemic as one of the biggest viruses that literally, not just Africa, but the entire world.
Right, that's true. I mean, I'm all smiles here. We also need to understand that the vaccine doesn't stop you from getting infected, but it increases your chance, a fighting chance of increasing the antibodies in your body that would ensure that the fight back at the disease or at the virus, as the case may be.
Yeah, because we've seen cases of people complain about, they took the vaccine and they still got exposed to this virus. That is why the World Health Organization came up with the booster shots, which some people have actually started taking. So, but one thing I can tell you for a fact is stop with all these theories that the vaccine will make you fall ill. Yeah, whenever you take any medication for anything, there are some signs that it will, bring some way it's going to, affect your body system. It's normal. So don't be scared about it. Go out there, get vaccinated, and also please try as much as you can to do what you need to do. Improve and build your immune system as well, because it's not just about taking the vaccine. If you're not eating healthy, if you're not keeping good health hygiene, I can tell you for a fact that you stand at risk of getting exposed to this virus. But definitely, we are winning the war. And before you know it, definitely this will be over. Back to you, Joe and Oluchi.
All right, thank you so much, Mike. That's the update, and that's the much we can take concerning